Hello, everyone, and welcome to today's lunchtime press conference for the EBSCO Health Ministers meeting that is taking place today. Discussions will still continue this afternoon, but we decided to have the press conference now. We're joined today by Health Minister Jens Spahn from Berlin and Commissioner Kyriakides here in Brussels. Just one thing in terms of housekeeping. Of course, there's translation available. We have German, English, French, Italian, Dutch and Spanish today on offer, so please make use of those languages. Of course, I will ask you to mute yourself when you're not speaking. Just one thing for the journalists, please, as always, use the raise hand button to indicate that you have a question. If you ask a question, I would just ask you, and I see already quite a few of you have your videos turned on. Please turn on your videos so we can also see you when you ask your question. I will now hand over to Minister Spahn.
Ja, vielen Dank, Frau Pfeffer.
Thank you very much, Commissioner. Ladies and gentlemen, this pandemic has Europe in its grip, and it's a challenge for all of us personally and as a society, but it also poses challenges to us as states and societies and the European Union. We can only combat the virus together. We all have to reduce our number of contacts to make life as difficult as possible for the virus. We have to be careful with our neighbours in Europe and beyond there. We've had to experience how quickly our health system in the EU has, in some circumstances, reached its limits, and it's important to rely on each other. Today, health ministers of the European Union, once again, under the EU German presidency, met at a video conference to debate a coordinated approach to combat the corona pandemic. It seems that this is likely to be the last meeting of this kind under the German presidency. Unfortunately, we haven't had an opportunity during our presidency to meet physically and in person, which I very much regret, because having a personal interchange is always very important. Having said that, we have found a very intensive way of working together in the course of the pandemics. 10 years ago, during the euro and financial crisis, the finance ministers found mechanisms for a swift reaction and interchange, but and this also applies to decision-making. And over time, we health ministers have already come up with an intensive form of exchanging opinions and reaching decisions, not only at ministerial level, but at all the various levels between our respective ministries. And I'm very grateful for that. In the trio presidency with Portugal and Slovenia, at the end of the year, Berlin will be handing over the baton to Lisbon and Portugal. I'd like to thank the Commission for the fact that a few days ago it tabled the EU pharmaceutical strategy. This is a good basis for our aim of becoming less independent from a number of producer countries, particularly China. So we want to strengthen the EU as a position in the world for manufacturing pharmaceuticals. So we now need to take up these proposals and follow them up with concrete steps and decisions. That's something that occupied us before Corona. That's something we have discussed over the last year. And above and beyond the crisis, we must quickly come to debating and implementing those regulations. This is very intensive. And colleagues have said that we have to do something, but we shouldn't be too hasty. We should have an intensive discussion, but be swift nonetheless. And our citizens should expect that in terms of using and assessing pharmaceuticals in the EU. We want to find a good compromise for improved cooperation without calling into question our tried and tested systems. For the first time, on the basis of the work done by previous presidencies, during the German presidency, we have come up with a comprehensive text for the regulation, which also illustrates a number of compromises that we want to discuss further. That obviously will go beyond our presidency, but I think it's important that we set the tone and provide the impetus. That's something we'll come back to. We've also set the scene for an EU-wide data collection area. Now, in that data area, data will be exchanged within the EU framework to improve the provision of medical care to citizens according to our standards and values, and not dependent on ideas about data protection elsewhere in the world. We looked at the current situation and we have some comfort. We are dealing with the crisis. We're collecting and going to roll out vaccines jointly. We're helping each other in patient care, and we've been very successful in linking up our warning apps. Germany, under its presidency, has strengthened the ability of the EU to act. We've been able to provide joint procurement of pharmaceuticals, and we've strengthened the role of the ECDC. And we've worked with the Robert Koch Institute, and we've made sure that Europe has a strong voice in the global arena when it comes to health. Lastly, let me say something about vaccines. That was an issue we addressed this morning. We heard about the state of play with regard to authorization. It's been quite an achievement over the last few months. We've been able to procure vaccines jointly. That was a deliberate decision. All 27 member states will then have access to vaccines at the same time. And otherwise, some member states may have been able to procure vaccines at an earlier stage than others. But we've decided to apply European solidarity right from the start to all 27 member states. So this has now been implemented with the Commission and all 27 member states together. So right from the start, we concentrated not just on one technology or one manufacturer. We decided to adopt a broad approach. We see from various candidates that there can be setbacks, there can be delays. AstraZeneca, for example, in terms of its timetable, there the situation worked out rather differently from what we'd expected. So we shouldn't just bet on one horse, if I can put it that way, but bet on a number, as we did. Right from the outset, we'll have authorization with phase 3 studies, which have just been completed. That provides knowledge in terms of the authorization. Many thousand volunteers have put themselves forward for that. That's important. The idea is not that we be first, but the idea is to have safe and effective vaccines in the pandemic, because it's only then, with that kind of procedure, that we can create confidence. And nothing is more important than confidence with respect to vaccines. Trust in vaccines is important. So once the authorization procedures are underway, we need to make sure that the appropriate quality standards are applied, but we also need to bring on board as quickly as possible all the various resources, and EMA has made it clear that we'll be able to do that. Health professionals and many others have been working night and day and over weekends in the pandemic to ensure that good healthcare is provided to patients, and we're grateful that the authorities involved in authorization will also work night and day, and if necessary over weekends, working on these studies and assessing them so that as quickly as possible we can come to a decision for the EU.
Herr Minister.
Thank you very much, Mr. Minister.
For the word to Commissioner Kyriakides.
Thank you. Ladies and gentlemen, Jens gave a very good overview of our discussions today in the Council. So I will focus on the pandemic and the strategy that we presented today as staying safe from COVID-19 this winter. The current situation is serious. It is delicate and precarious. We might be seeing a stabilization in numbers in the EU, but this is a stabilization at very high levels. Every 17 seconds, a person loses their life due to COVID-19 in Europe. And every day in Europe, more than 5,000 families are grieving the loss of a loved one. Our doctors and nurses are once again fighting an uphill battle to care for patients, and not only those sick with COVID-19, but the many patients for whom surgeries and treatments once again have had to be cancelled. at the upcoming end of the year and what is usually a festive period with family and friends does not make it any less serious. On the contrary, if we are not careful, if we do not practice self-restraint and discipline, if we relax too quickly, if this relatively more stable period is not used to prepare, we will have more cases, more deaths, and more lockdowns. This was true back in July, and it is true now. But this time, we have the chance to do things differently. We could not have been more consistent in our guidance to member states from our recommendations in April until the updated strategy for staying safe and controlling COVID-19 that we are presenting today. Until vaccines can be successfully deployed, measures to control and mitigate the spread of the coronavirus must continue over the next few months. And this in particular during the end of the year holiday period. Now, like everything else this year, end of this year festivities are going to be different. And this is inevitable. This year, saving lives must come first. We don't want to cancel Christmas. We want to make Christmas safe for everyone. We know that the sacrifices for keeping each other safe are high. But we cannot allow the risk of seeing Christmas or New Year's celebrations becoming super spreading events. It will be an end of the year where our individual and collective actions save lives. We understand the mental strain that control measures are putting every single one of us under. And this is why today we are calling on member states to ensure access to psychosocial support for those in need. But there is also hope. Vaccines are on the horizon. There may be finally light at the end of the tunnel. I will be soon signing our 6th contract for COVID-19 vaccines. Altogether, our joint negotiations under the EU vaccine strategy can potentially give us access up to 2 billion doses of future safe and effective vaccines for EU citizens and for citizens globally. And with the first request for conditional marketing authorization submitted to the European Medicines Agency this week, we are now able to slowly start looking into much needed hope for the future. This is an incredible achievement in less than 6 months, made possible thanks to our EU vaccine strategy, a truly European solution to a common priority and concern. A case in point of what a future European health union will be able to deliver. And the full or partial lockdown in many member states in recent weeks have driven down infection numbers and the burden of our hospitals. But still this week, deaths are rising. If we all work together and adhere to the 3 C's, avoid closed spaces, crowded places, and close contacts, and if we all continue to wear masks and wash our hands, then we collectively can keep pushing this virus back. If all member states ensure sufficient testing capacities and contact tracing, including the deployment of tracing apps, we can break transmission chains. And if everyone ensures that health systems are sufficiently reinforced, we will be in a better place to mitigate new outbreaks. Ahead of the winter holidays, we need a coordinated approach in Europe to make sure travel is safe, to avoid chaos and confusion. Citizens must have clear information on testing, isolation, and quarantine rules. And importantly, as underlined to ministers, we need to give our citizens a clear roadmap for exiting the pandemic. If the easing of restrictions are linked to clear and visible targets, it will be easier to comply to measures. And this will be our task for early next year. Ultimately, the solution will come from safe and effective vaccines, or rather, from vaccination itself. Vaccination will be the make or break challenge of 2021. We must ensure that citizens have access to clear and unbiased information on COVID-19 vaccines, because only informed citizens can make informed decisions. The ECDC is today publishing an overview of the main aspects of the Member States' national vaccination plans that are currently under development. When fighting COVID-19, every single person's effort counts, and everyone's efforts are needed. And in ending, I want to say a final word. I want to thank Jens for his support now and over the last 6 months. We have really been working hand in hand to respond to this unprecedented health crisis to protect our citizens. Jens, thank you so much for the excellent cooperation. And of course, I look forward to the Portuguese presidency taking over the baton. And they can be sure to rely on me as a friend and an ally for their work. Thank you.
Thank you, Commissioner. Can I just remind everyone to please turn off your microphones because we heard quite some background noise there. We'll now move on to your questions. I see there are quite a few questions, and we do have to get back to the meeting eventually. So please make your question very concise, so we have time to take most of them. We'll start with Gillian Dutch from Politico.
Hi, thank you so much. Also, thank you to Commissioner Kyriakides, Minister Spahn for your time. I have two quick questions. The first is for Minister Spahn. We have seen Germany secure additional coronavirus vaccine doses outside of the Commission's vaccine strategy. For example, the IDT Biologica, we have 5 million doses of those, and I've also heard of extra doses for BioNTech and CureVac. I was wondering if this goes against this, EU coordination approach. If you have a comment on that. The second question is, of course, about the vaccines. EMA chief today said that a vaccine might be approved as late as December 29th, the BioNTech Pfizer vaccine. And something the health minister said that they plan to start vaccinating in early January. Meanwhile, the UK could start vaccinating next week. Do you think this is an issue for the EU27? I mean, is the EU moving too slowly? Thank you.
Minister Spahn.
Ja, danke schön.
Thank you. First of all, on the issue of vaccines, the Commission and the European Union is not negotiating with the EDT, so to that extent there's no friction or problem. It was never agreed that the fact that we're negotiating at European level with various manufacturers that would not be possible for member states to do likewise. EDT is not negotiating with the EU, which is why we have entered into negotiations at national level. BioNTech and EUVEC are companies that we approached only once the EU procedures have been concluded, when it became clear that all 27 member states would procure vaccines which reflected their need and would enter into additional negotiations for extra doses. I'd like to say one thing. In August and September, Germany was practically the only country which was buying vaccines to a large scale. 300 million doses would have been something that could have been in the picture, but we thought we could have had a larger number. But there was not really a larger need from member states at that stage that only emerged 3 weeks down the line. I'm simply describing the situation to make it clear that only thanks to the big commitment on the part of 1 or 2 member states in the summer, and Germany was one of those, that the EU contract with BioNTech came into being at all, and this also applies to other areas. Then on the issue of the UK and the European Union, we have to note that there are different procedures and different approaches in the US and the UK. They are based on an emergency rapid authorization. In that respect, we would prefer to have a regularly conditional procedure using the tried and tested procedure that could lead to some difference in timing. But health practitioners are working night and day and over the weekend, which we can also expect from the authorization authorities. We hope we can work swiftly. And then for our British friends, I'd make a number of comments. We may have read some comments on Brexit. BioNTech is a European development funded by the European Union, and it shows that if a product from the European Union is so good that it is authorised so quickly in the UK, that in this crisis, what is best is European and international cooperation.
Thank you, Minister. I don't know, Commissioner, did you want to add anything?
Yes, I'd like to add something, just if possible. Thank you, Gillian, for those questions. First of all, I'll just add on the second question that we're doing everything possible to ensure that vaccines are developed as fast as possible and, of course, as safely as possible. And we cannot predict a date with certainty, as delivery timelines depend on each contract and the safety evaluation. But once we have EU marketing authorization, is concluded, we hope that by early next year, member states will be able to start vaccinating and protecting those who, as a priority, who are more vulnerable. What is important to understand is that once authorized and produced, each vaccine will be available to member states at the same time. And I think that this is a crucial part of this strategy. It is up to the national authorities to organize how fast and accessible deployment this happens. And this is why we've been working with them for their national vaccination plans. I will also add on this that for us, from our side, COVID-19 vaccines will go through an independent scientific assessment of the quality and safety and efficacy. And this is crucial because to ensure that only safe and efficient vaccines are placed on the EU market. And vaccine safety is priority number one. So I wanted to stress this because it's also important to get these messages across to citizens, because citizens need to be able to feel confident to go ahead and be vaccinated. And this is why we are stressing this over and over again. Thank you.
Thank you, Commissioner. Next question goes to Thomas Gutschka, FAZ.
Ja, vielen Dank.
Thank you very much. I have a question to Minister Spahn. The Commission today issued recommendations for how to relax measures around the Christmas period. Now, I want to know what you think about these recommendations. For example, the Commission's recommendation that there must be strict quarantine before and after people meet for at least 7 days. And they also say that we work on the basis of household bubbles, so that we can't have people coming into contact with different groups. This isn't the same as what we have in Germany, the 10-person rule. So what do you think this will lead to more discussions with your colleagues in the various different countries to adapt the German rules? Well, yes, these are, as you say, recommendations. And these are basically the same recommendations we provide to our citizens. After the last few days, some people are saying, no, I can't meet with 10 different people in 2 different days, and then you don't count children among them. So, I mean, this is not how we have imagined it. We have to think about how we adapt. We can't be just about mandatory rules which come down from above, from the state. I think these recommendations are appropriate. I think if there's any doubt, then you should meet with as few people as possible, and people from your own family, and from as few households as possible. Now, we have a number of federal states who've started their Christmas holidays sooner to and there we'd recommend that people reduce contact as much as possible. It's very important that here, as citizens in Germany, that we take on board our own responsibilities. Sometimes I don't understand this approach that everything should only be permitted, done in line with what comes down from above, from the state. And then when it comes to the EU, it's important that we bear in mind that we've got through the crisis well together, and we've only been able to do better because our citizens worked with us. I think that is what's most important is for citizens to say to themselves, that I'm going to be careful. It's not a question of telling people what they have to do for Christmas. I just think it's very important to give people general rules and allow people to take on board their own responsibilities. A follow-up question. The sound quality, unfortunately, isn't. So the recommendation talks about strict requirements, the introduction of strict requirements to deal with this. So binding rules. So you say you agree with the recommendations, but then there's actually a contradiction there, because they are asking for strict requirements, and you're saying you don't always want those. So you just said it yourself. The Commissioner is recommending we do this. I don't want to go on about this. I presented to you what the German position is on this. I don't know whether it'd be really useful where we start telling people across Europe who has to do what, why and when during the Christmas period. Ultimately, I think it's important that we adapt ourselves to the situations. It's true that the rate of infection varies across Europe, and it varies across Germany as well. There are a number of federal states who've announced that they're not going to introduce any relaxation during the Christmas period. So some regions are introducing stronger restrictions than others in accordance with their infection figures. And so we take these as recommendations, and I'm sure that leaves enough room for countries to adapt according to their own situation.
Question, because we still have quite a few questions, so your colleagues can also ask them. Next up is Verena Schmidt-Roschmann, dpa. Verena?
Yes, I'm fighting with my... Yes, I hope you can see me and hear me.
Yeah.
I had a small technical problem. Thanks for the question. It is to Commissioner Kyriakides. A follow-up on the vaccine question. Just bluntly, do you expect the EMA to speed up the procedure now after the UK decision? And is it due to Brexit that they are faster than the European Medical Agency? Thank you.
Commissioner? We see you, Commissioner.
Yes, thank you. It's having to mute and unmute. First of all, I want to just comment on the previous question, if I may, because it was referring to the recommendations we put out today. These are recommendations, clear recommendations. And as I said in my opening remarks, we are at a time that we need to work together. And all of us, I think over the last at least now 10 months of this pandemic, as citizens, we all know what we need to do in order to contain this virus as much as possible. So, in fact, what we do not say is that we need to decrease the restrictions quickly. We are saying the opposite. We're saying that the lifting of the restrictions too early increases the risk of an escalating resurgence of the virus, and we're putting forward recommendations to member states as we have done before. There is no one-size-fits-all. Clearly there isn't, but these are science-based recommendations, and there are certain principles that we all need to know, and I have mentioned them. The 3 C's: close contact, crowded places, and closed spaces. We need to do this and show self-discipline as we have been as citizens in order to be able to contain the virus in the next few months. So this is what we put forward today. Now, in terms of your other question on vaccines, I'll say just one or two points, which I think one was, I think the question was on the next steps for EMA. So the scientific opinion of EMA, of course, you know, plays a key role for the approval of the COVID-19 vaccines. When it comes to the process, once a vaccine developer has submitted the results of all the necessary investigations to EMA, in the context of a centralized marketing authorization application, this is then evaluated by EMA's independent scientific committees. And once that evaluation is finalized and the data is sufficiently robust and complete, EMA would recommend a marketing authorization. So we are moving now with this, and I will say once again that safety for us, vaccine safety, is priority number one. It has to be clear to all that vaccines will be assessed for their safety and quality and efficacy. We will do our utmost to speed up the decision-making process once EMA has given its scientific opinion and complete the steps as a matter of urgency, including those that we need to do consulting member states, which can be done in a matter of a few days. So I think that is where I would leave it for the moment. Thank you.
Thank you, Commissioner. Next question goes to Sophie Petitjean from Agence Europe.
Yes. Hello, Sophie Petitjean from Agence Europe, yes. Thank you very much. So I have two questions. The first one is about the skiing. So different member states asked during the debate for a more coordinated approach. I was expecting something in the recommendation today, but there is no reference at all on this. Can you maybe comment on that? And about maybe there was also a request during the debate from Belgium to adopt EU threshold in terms of the epidemiologic situation. Is there something the Commission is planning to put forward? And maybe, if I may, just a political comment. Don't you think that this recommendation comes a little bit too late, as the majority of member states have already announced what they are planning for the Christmas period? Thank you very much.
Thank you. Over to you, Commissioner.
Thank you for the questions. Well, I'll answer that in terms not specifically of skiing, but of winter tourism, because I think that's what we need to address. And I will approach that we need to look at the principles behind any sort of activity that we undertake in the coming months. And these principles are the same. Until we have a safe and effective vaccine, we need, and this is what we are urging all member states to continue their efforts to mitigate the pandemic. So I realize that the end of the year holidays are a very important date in the calendar for many of us in Europe. But it is also important that we understand that we are dealing with a pandemic, that this virus is circulating amongst us, and the principles that we have put forward throughout in the last few months do not in any way change now. It's important that no restrictions are eased in a way that will jeopardize the progress achieved in the recent months. In your other question, I think that what is important also is that we're following the scientific advice coming from our agency, from ECDC, and as I underlined to ministers, we need to give the citizens a clear roadmap for exiting the pandemic. And in order to do this, we need the easing of restrictions to be linked to clear and visible targets, because this will be easier for them to comply with the measures, and this will be our task for next year. Thank you.
Wenn ich nur kurz ergänzen darf zum Skifahren.
Can I add something briefly on skiing? I can say that I very much welcome the Austrian measures which have just been announced today. All of us have experience from February and March. That's still very apparent. People returning from ski holidays across the whole of Europe, in practically all EU member states, unknowingly brought home the virus. It wasn't skiing in itself that was a problem from an infection point of view, but the activities surrounding skiing. So I can only welcome the decision which the Austrian government has taken on quarantine requirements.
The next question goes to Francesco Guarascio from Reuters.
Hi, good afternoon. A question to both the Minister and the Commissioner. On the approval by the British regulator of the Pfizer vaccine. This approval, as you know, as you have already said, has been an emergency approval done on the basis of only partial data, which the regulator had only a week to check. Do you think that this could damage confidence in vaccines among the wider public, given that effectively the UK regulator is telling the world that they will check the effectiveness and the safety of the vaccine only after its rollout? Thanks.
Thank you. Commissioner, do you want to come in first?
Yes, gladly. Thank you for that question. I will comment on the way the UK has moved or not. I don't think that is really my responsibility, my competence. What I would say is again that it's crucial that we ensure that the vaccines that we approve and placed on the EU market are safe and efficient. So what we have before us is a conditional marketing authorization. This provides for a controlled and robust framework for assessment. This is different to the emergency use authorization, which will be issued by other countries. Our authorization ensures that all pharmacovigilance, manufacturing controls, including batch controls for vaccines and other post-approval obligations, apply in a legally binding manner and are evaluated on a continued basis. And these are essential elements to ensure a high level of protection to citizens during the course of a mass vaccination campaign, because this is what we are discussing here. So temporary emergency approvals differ from conditional marketing authorizations in the level of the evidence submitted and that is needed and the checks required. And contrary to an emergency use authorization, a conditional marketing authorization is an authorization which allows for the marketing of the medicine, whereas an emergency use authorization does not. So this is how we are proceeding, and we are now have these submissions to the European Medicines Agency, and they will have the time they need in order to come back with their scientific assessment. Thank you.
Thank you.
Just very briefly, first of all, we've been working very closely on these issues with our British colleagues. It's a personal commitment of mine because, yes, it's true that the virus doesn't know any borders, and that means that there are no borders in Europe, and it goes beyond Europe and the European Union as well. So it's very important that we cooperate as close as we can with the UK. So I've had extensive exchanges with them, and I know what high levels of professionalism and knowledge they've been working on this issue. So they've maybe got a slightly different approach to the one we have. Of course, we have member states, including Germany, who could have issued such an emergency authorization if we'd wanted to, but we decided against this, and what we opted for was a common European approach to move forward together. And as the Commissioner quite rightly said, it's very important we do this to help promote trust and confidence in this authorization. So there may be slight differences in the issuing of authorizations between the US, the UK and the EU if this is just a short period of time. And we'll also have an opportunity to collect more information, and I'm sure that once the British have collected information, they'll be able to pass on to us as well. Thank you.
Carlo Mattuscelli from Politico. We cannot hear you. No. No, sorry. I will just go to the next, and then maybe you try again. Next one is Caroline Mitter-Beisel, SZ.
Thank you very much for taking my question. It is a question to the Commissioner. In your recommendations, you also advise or encourage Member States to think about extending school holidays or introducing a period of online learning after the festive season. And I was just curious, don't you think this will actually encourage people to travel, whereas usually the messaging is always to minimize travel as much as possible, also given the fact that WHO deems school closures not effective measures to control the virus and advises to avoid them as much as possible. And if the Minister wants to add to that, what would be a solution for Germany to this question, I would be happy to hear that as well. Thank you.
Commissioner?
Yes, of course. Thank you for that. Thank you for that question. Well, it's definitely evident that in the last 10 months we've had to look at all the issues that have to do with travel in a different way. And this is what we have put forward in our recommendations. And the reason that we attach this is that for those that decide that they're going to travel, we need to also link this on to how they can then be in a way safer if they're exposed when they return from the traveling. So we are very aware that the upcoming holiday season does pose particular challenges and risks, that traveling and social contacts are part of these, but it's not the travel in itself possibly that entails the risk, but what follows with the travel. And this is why we're constantly stressing the principles that I have already stressed before, that we need to ensure that physical distancing and limiting social contact, as Minister Spahn has already said, remain key. And in order for this, we need to be sure that we're prepared. We have put forward recommendations trying to address the many issues that I'm sure are in citizens' thoughts at this time of the year. But the key issue is that we are still in a very difficult stage of this pandemic. And we have to do everything possible not to be faced with a situation in January that we could have contained in a more effective way. And this is our responsibility, to send out these messages. Thank you.
Thank you. Minister, do you want to add anything? No. Okay, we have time for 2 more questions. Then we have to go back to the meeting. Carlo, do you want to try again?
Yes. Can you hear me?
Yeah.
Great. So I have 2 questions. The
I give you
first one is both for the Commissioner and for the Minister. And this is on the health union proposal. We heard some significant pushback from other member states in the video conference earlier today. I wanted to know if you expected resistance to the proposal and how were you thinking about pushing through these concerns. And then I have a second question about vaccines. I just wanted to know if you had any indication of how well prepared countries are for the rollout. Thank you very much.
Zur ersten Frage und vielleicht können wir es einfach auf.
On the first question, perhaps the Commissioner could deal with the second question. That would be more efficient. On the European Health Union, I use different terms. Some countries, understandably, have said that they need intensive discussion and examination. It's a matter of competence in some areas. As you know, I'm somebody who attaches great importance to having a clear dividing line between what are national and EU competencies in the area of health. And at the same time, and this is something that I've summarised in my conclusions, there's a justified expectation on the part of citizens that we actually learn from the crisis while it's underway. It's not a process that will be contained just to a short period. In terms of production of certain substances and medical products, we cannot continue to be so dependent on China and other regions of the world as we have been. We need to strengthen EMA and ECDC. There's a large degree of agreement on those basic principles, but when it comes down to details, obviously further discussion is required. That became quite clear. As it happens, there are different nuances between member states in terms of the public statements they made and the points raised in discussions, but certainly Germany wouldn't want to say anything further on that. That's something that occurs time and again in discussions. I'm optimistic that next year, certainly for the ECDC mandate, that there we will make progress, because it's important not just for Germany but for other member states as well. And I think that would be a matter not just for discussion but would actually ideally lead to a decision as well.
Commissioner, do you want to come in on the...
Yes. Thank you. I wouldn't use the word pushback in terms of the reactions and the responses we had from ministers. I think these were totally understandable, and I have absolute respect for them. And I was expecting this in the sense that we put forward a proposal for a European Health Union, and the least that one would expect is from 27 member states and their ministers to have questions, to want more clarifications, to raise concerns. But on the whole, I would say that this was very well accepted, because we all agreed, and everybody agreed, that there is now a life-changing situation for us all, and we need to look forward. And there is an opportunity, and we need to listen to what citizens have been telling us for the last at least 10 months. Citizens want more health and more Europe in the area of public health. We were asked to deliver on this, and we put forward a proposal that will strengthen our agencies, and a proposal that will allow the European Union and, of course, the European Union is member states to be more prepared, more resilient, and more proactive at a time of crisis. So for ourselves, these were very welcome interventions today. There will be a lot more discussion, I'm sure, and there needs to be a lot more exchange so that we understand where we're all coming from. And I will say what I also said this morning: what we proposed is well within the treaty, and we need to finally move out of this almost taboo subject of competencies. We propose what is within the treaty. We need a stronger European Health Union. We need to be better prepared. We are in the middle of a pandemic. Nobody can tell us that there won't be another health crisis down the road. And we owe it to the European citizens to deliver on a Europe that is there for them at a time of need in an area of health. And to come to your second question, all the member states have now submitted their vaccination, COVID-19 vaccination strategies to us. We are at the point now when we're looking at some of them in more detail, because it's important that once the European Medicines Agency comes forward with a scientific opinion, member states are ready to deploy the vaccines to reach the citizens as soon as possible, and we have been working on this since October. So we are not going to delay for anything.
Thank you, Commissioner. I'm afraid we've run out of time now. Thank you for this very interesting exchange. If you have any other questions, maybe just send us an email and we'll get back to you. Thank you to the Minister. Thank you to the Commissioner. Of course, thank you to the interpreters. And thank you to the... Mr. Spahn, your audio's on. Oh. And thank you to the staff.
I just asked why we are there. Whatever. I would have taken one more, but you are the boss here.
If you want to take one more, we can, if the Commissioner still has the time. Go ahead, Marion. Then Marion Schneider, Presseagentur Gesundheit, ask a question.
Ja, vielen Dank.
Thank you. I'm very happy to be able to ask this question. It's about the effectiveness of the vaccine. There seem to be significant differences. How will this be taken into account when it comes to vaccinations? Will there be priority given to the more effective vaccination? Or how is your planning surrounding that? First of all, we have to say that we've started to think about this in the EU. What level of effectiveness do we want? What's the minimum level of effectiveness? And then when we started talking about this, we said over 50%. And now we're talking about 90% or 94.5%. So this is high level and promising levels of effectiveness. But even from AstraZeneca, that is very much within a range which is very much above that. AstraZeneca has also decided to conduct additional studies. And then there's a specific question about which vaccine for which group. Then we have to think about with what age group we're working with as well. I do nonetheless think it would be a good idea to look at the various different levels of effectiveness, particularly when it comes to procurement. What we want to make sure that there's no studies, for example, on effectiveness for children and how we introduce that vaccine.
This was the real final question then. Thank you to everyone. Thank you to the Minister and Commissioner. Thank you to the interpreters. Thank you to the staff in Berlin and Brussels who made this possible. We will now go back into the meeting and wish you all a good afternoon. Bye.